Hello, my name is David Rojas, and my presentation is over the issue that can occur when a patient is brain dead and kept alive, and why it's so debated on whether or not this is morally and ethically correct. To start off, I would like to explain what it means to be brain dead, and how these people are kept alive. Brain death is essentially when the brain has experienced a traumatic injury or a subarachnoid hemorrhage, being bleeding between the brain and the tissue covering the brain, which leads the patient to lose consciousness and all functions, leading to a full body shutdown, causing death. But with the help of ventilators, the body is able to receive oxygen and the machine is able to remove carbon dioxide. Although the body is being kept alive, there is no way that the patient will recover since the brain can no longer be restored. Now, this is where the whole argument starts to kick in. A perspective can be that the body is technically still functioning and that they cannot be fully considered dead because the ventilator is providing oxygen, keeping the organs alive. I found a really good example that can help support this claim, which is pregnant woman with brain death. Now, this really caught my attention because it never crossed my mind that someone who is pregnant could experience brain death. This is where my perspective started being challenged. I was confident that patients diagnosed as brain dead should not be kept alive for long because there was no point. From the information I gathered from the BMC Medicine, they found 30 cases in which pregnant women experienced this. Out of 30, only 12 had successful births, which is pretty good considering that the mothers were not alive during the process. But my main problem with this is the time that the mothers were kept alive. For example, there were 2 cases in which the infant was delivered 2 days after the mother was diagnosed. But there were 2 other cases in which the infant was delivered more than 100 days after the mother was diagnosed as brain dead. Obviously, there were complications such as infection, hemodynamic instability, and diabetes that developed within the mother over the past days that she was kept alive. In this scenario, cutting off the ventilator will cause the infant to die along with the mother. At this point, I started to believe that maybe those who are pregnant should have a time period of the infant's development for it to be vital to keep the mother alive. But at the same time, the mother should have a say if she wants to be kept alive if this scenario was to happen. Because it's almost like an abortion. There has to be some type of agreement. This leads to the other side of the argument that those who are brain dead do not need to be kept alive for long because there is no way for them to restore their brain function. This is true, and the ventilators give a false sense of hope to the loved ones, which is the reason why these patients are kept on ventilators for so long. I now believe that there can be exceptions for this argument, but for the most part, I agree that after a few days, it's time to let the person rest for good because they are not coming back. I did find out though that donated hearts from a person that is brain dead is the most reliable source as far as heart transplants go. Although organ transplants are more complicated with people who are diagnosed with brain death. Since these patients are kept alive for so long, their organs begin to develop diseases or inflammation, which the receiver can reject and leading the organs to be useless. Overall, from the information I gathered, I still believe that those who are brain dead should not be kept alive. Although there are cases where situations get more complicated But for the most part, unless there's a reasonable explanation, the patient has passed and their bodies should be able to go away. Thank you.